Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into diabetes in pregnancy, safe exercises for pregnant moms. You'll discover safe, effective exercises to keep you and your baby healthy while managing gestational diabetes. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. This causes blood sugar to rise. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. If not managed, gestational diabetes can lead to risks like a larger-than-average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Today's focus is on safe exercises, so let's explore how to move your body safely. Exercise is a fantastic way to manage gestational diabetes because it helps your body use insulin better. It also keeps you strong and boosts your mood during pregnancy. But not all exercises are safe, so let's talk about ones that are. Always check with your doctor before starting any exercise routine, especially if you have gestational diabetes or other pregnancy complications. Walking is one of the best exercises for pregnant moms. It's low impact, easy to do, and you can adjust the pace to your comfort. Aim for 20 to 30 minutes most days of the week. You can stroll in your neighborhood, at a park, or even on a treadmill if you prefer indoors. Keep a steady pace where you can still talk without feeling out of breath. Another great option is prenatal yoga. Yoga improves flexibility, reduces stress, and helps with blood sugar control. Look for classes designed for pregnancy, which avoid poses like lying flat on your back or deep twists. A simple move like the cat-cow stretch can ease back pain and keep you moving. Swimming or water aerobics is another excellent choice. The water supports your growing belly, reducing strain on your joints. It's also cooling, which feels great if you're feeling overheated during pregnancy. Try gentle laps or a water aerobics class for pregnant women. Aim for 20 to 30 minutes, 2 to 3 times a week. Stationary cycling is safe too, because it's low impact and you can control the intensity. If you're new to cycling, start with 10 to 15 minutes and gradually increase. Keep your heart rate under 140 beats per minute or follow your doctor's advice. Strength training with light weights or resistance bands can also help. Focus on exercises like seated arm curls or leg lifts to build strength without overdoing it. Avoid heavy lifting or exercises that involve lying flat on your back after the first trimester. Let's talk about how to exercise safely. Always warm up for 5 to 10 minutes with light stretching or walking to get your muscles ready. Stay hydrated by drinking water before, during, and after exercise. Wear comfortable, supportive shoes to protect your feet, especially since pregnancy can cause swelling. Listen to your body. If you feel dizzy, short of breath, or have any pain, stop immediately and rest. Avoid exercises with a high risk of falling, like running on uneven surfaces or contact sports. Also, skip hot yoga or exercising in extreme heat, as overheating can be risky for you and your baby. A good rule of thumb is the talk test. If you can't hold a conversation while exercising, you're pushing too hard. Keep it gentle and consistent. Why does exercise help with gestational diabetes? Moving your body helps your muscles use glucose for energy, which lowers blood sugar levels. It also improves insulin sensitivity, meaning your body needs less insulin to manage sugar. Regular exercise can reduce the need for medication and lower risks like macrosomia or cesarean delivery. Plus, it helps with common pregnancy complaints like back pain, fatigue, and swelling. According to a 2021 study in the Journal of Obstetrics and Gynecology, pregnant women with gestational diabetes who exercised regularly had better blood sugar control and healthier birth outcomes. Even 20 minutes a day can make a difference. You don't need a gym, your living room, a park, or a pool can be your workout space. Let's bring this to life with a story. Meet Sarah, a 32-year-old expecting mom diagnosed with gestational diabetes at 26 weeks. She was worried about her baby's health and felt overwhelmed. Her doctor recommended safe exercises to manage her blood sugar. Sarah started walking 25 minutes every evening with her partner, which became a relaxing routine. She also joined a prenatal yoga class twice a week, focusing on gentle stretches like the seated forward bend. To her surprise, she felt more energized and less stressed. She paired this with a diet of low-glycemic foods like oatmeal, veggies, and lean proteins. By her third trimester, her blood sugar was stable, and she delivered a healthy 7-pound baby girl. Sarah's story shows that small, consistent steps like safe exercise can make a big impact. What should you do to get started? First, talk to your doctor to confirm which exercises are safe for you. If you're new to exercise, start small. Try a 10-minute walk and gradually increase to 20 or 30 minutes. Schedule your workouts at a time that works for you, like after breakfast or in the evening. Invite a friend or family member to join you for motivation. Track your progress in a journal, noting how you feel after each session. If you're experiencing symptoms like excessive thirst, frequent urination, or fatigue, mention them to your doctor. These could be gestational diabetes symptoms, and you may need a gestational diabetes test, typically done between 24 and 28 weeks. The test involves drinking a sugary solution and checking your blood sugar after an hour or two. Catching it early means you can start habits like exercise to manage it. Here are a few extra tips to make exercise fun and sustainable. Create a playlist of your favorite upbeat songs to keep you moving during walks. If you're doing yoga, set up a cozy space with a mat and calming music. Join a prenatal exercise class to connect with other expecting moms. It's a great way to stay motivated and make friends. If you're short on time, break your exercise into 2 10-minute sessions, like a morning walk and an evening stretch. Pair your exercise with a healthy diet to maximize blood sugar control. For example, a gestational diabetes diet might include a lunch of grilled chicken, quinoa, and steamed broccoli. Avoid sugary snacks and drinks, opting for water or unsweetened tea instead. Small changes add up, and you're doing this for you and your baby. To wrap up, today we covered diabetes in pregnancy, safe exercises for pregnant moms. You learned why gestational diabetes happens, how exercise helps, and safe workouts like walking, prenatal yoga, swimming, and light strength training. We also shared tips to exercise safely and a story of how Sarah managed her gestational diabetes with movement and diet. You're now equipped to take charge of your health with simple, mom-friendly steps. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below. Have you tried any of these exercises, or do you have other tips for managing gestational diabetes? Let us know. Subscribe for more videos on gestational diabetes symptoms, diet, and pregnancy tips. Check out our playlist on gestational diabetes management for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching, and see you in the next video. Disclaimer: this video is for informational purposes only and not a substitute for professional medical advice. Always consult your doctor before starting any exercise program or making health changes during pregnancy.